A very good morning to all of you. Myself, Dr. Poonam Savarkar, PhD Panchakarma, Associate Professor, MGSC, Wardha. I am here presenting my topic, that is critical appraisal of effective role of Ayurveda to maintain the public health in the current scenario. As we are already aware about the current scenario of COVID-19, that it is a very frustrating entity to medical field and having dreadful impacts on global health system and economy also. This situation highly emphasizes over the health maintenance by building the immunity, and so searching for alternative options in Ayurveda, which is the holistic science that highly emphasizes over the prevention of disease rather than its cure. Though there are miraculous results of Ayurvedic treatment modalities, but there are certain most of the people are unaware about their uses on scientific and rational ground. Moreover, most of the common people undergo these modalities without any prescription, and so create many adverse events with a lot of expenditure of money. And so, critical analysis of all effective modalities in Ayurveda should be critically analyzed. Through this literary work, sincere efforts are taken to create awareness regarding effective but scientific rational role of Ayurveda to maintain the health. To clear up the doctrine on effective role of Ayurveda to maintain the public health in the current pandemic based on scientific ground, this is the prime aim of this paper. And for this purpose, in material method, various literature is searched from classical text of Ayurveda along with multiple research articles available on scientific databases such as the PubMed, Google Scholar. These are some heads which we will narrate little by little, that is observation and result, that impact of this current scenario in the health, which leads to the overall poor health status of the person, that makes the person more susceptible for the disease. Along with that, it brings the disturbances in physical, mental, social and economical status also. There are certain various effective treatment modalities are explained in Ayurveda in the form of pharmacological interventions and non-pharmacological interventions for the management as well as prevention of the disease, that includes drugs and procedure in pharmacological, yoga, Surya Namaskar, meditation and lifestyle modification in non-pharmacological intervention. This is the concise review of Ayurvedic herbs, Panchakarma and yoga for the maintenance of health in the current pandemic. Details of the drugs which are useful in current scenario are tabulated in this table. Who can take beneficiate for the Ayurvedic measure, that is any age group, that is even pediatric or geriatric population, person who are highly susceptible or vulnerable for getting infections such as health professional, caretaker, adolescent, geriatric person, those person who are contraindicated for established treatment modalities in modern science and for vaccination also, patients with comorbidity and a job seeker. But there are certain precautions should be taken while adopting these treatment modalities, as Ayurvedic drugs should be taken with the prescription of learned Ayurvedic physician, and use of only authentic and GMP-fied certificate of Ayurvedic medicine should be taken. Along with that, simultaneously, the constitution of the person, gender, nature of bowel habit, physical and mental strength of the person should be taken into consideration. And various do's and don'ts which are mentioned in the classical text of Ayurveda should be strictly followed during the Ayurvedic measures. Coming to our discussion, the probable mode of action of Ayurvedic intervention can be in two ways, that is immunity modulator treatment modalities and stress relieving refreshment modalities. Immunity modulator treatment modality, that this role can be explained as most of the drugs and Panchakaram procedure are immunomodulator, anti-stress, antioxidant, digestive stimulant, anti-inflammatory. That's all procedure enhances blood circulation to the all the body. Along with that, all procedures cleanses the circulatory channels and normalizes digestion, metabolism, and nutrition in the body. It also strengthens the body by nourishing tissues, organs, and offer good physical as well as mental strength. It increases the ability of an organism to adapt an environmental factor and to avoid damage from such factors. So it is also useful in different kind of people such as in addiction alcohol, or even person who have lost their educational and social facilities in the lockdown period. The role of stress relieving and refreshing modalities in Ayurveda can be explained as it maintains the physical fitness during lockdown period by offering strength to the lungs. It is useful for the person who are affected with stress induced due to financial and employment instability. It helps to resolve the panic stage of an affected area's population by an epidemics by improving patience and optimistic thinking. It is useful in different person who are susceptible for such pandemic. It reduces the negative onslaught of stress which harms the immune system. It induces immunomodulation by affecting WBC macrophages and even decreases susceptibility after prolonged exposure to causative factor, especially by improving the function of lungs and increases better resistance. It improves immunity by increasing appetite by putting the pressure on the GIT. all these treatment modalities perform main role in the initial condition of the disease and for prevention. An adjuvant or complementary role of Ayurveda can be useful in advanced condition of the disease to avoid the severity of the disease and complication, to enhance the therapeutic outcomes, and to reduce the rate of morbidity as well as mortality. It maintains the physical and mental strength with improvement in digestion, metabolism, and nutrition at both GIT and cellular level. It controls the source of infection, interrupts its route of transmission, and avoid recurrence of the disease. That is coming toward conclusion. Integrative approach of Ayurveda, comprising herb, Panchakarma procedure, spiritual practices, helps in developing immunity through their pharmacological and non-pharmacological role through immunomodulation and stress relieving activity. It can be helpful to COVID to avoid or reduce increasing burden of comorbidities such as lifestyle disorder. Then Ayurveda can be considered as a complementary therapy to maintain the public health during pandemic to prevent and control communicable diseases. Further clinical trials are expected in future to embark this conclusion with generation of clinical evidence. These are the references which I have followed. Thank you. Thank you very much.